Nobody will bother all those things. Okay. That is just for you, no?
Okay, I think it will. Okay.
Nobody will see all these things. Nobody will bother all those things. Everyone's no. Okay, right. No worry. That is just for you, no?
Okay, I think it will. Okay.
Nobody will see all these things. Okay. Yeah. So here is the card. Yeah, prepare for 1 minute at least. Or if you are ready, we'll start. Yes, Swati, you can start now.
Yes, sir. Good morning.
Good morning, doctor.
Start from your name.
Yeah, my name is Abraham Lincoln and I'm 45 years old.
Okay, Ibrahim. As I'm going through your case note, I know you just suffer from a major cardiac event. Is that right?
Yeah, of course. I am recovering from a mild heart attack, which happened 2 years ago. I was discharged from hospital 4 days back. I'm unsure how much physical activity is appropriate, and I'm seriously worried. I am weakening. I fear that any physical activity will trouble me.
Okay, how are you feeling now?
I am feeling very tired, doctor. I'm concerned about my future. Can you please help me, doctor?
Please don't worry about it because you had just had that major cardiac event just 2 weeks ago. So it's just a normal phenomenon that even after any cardiac event, you may feel tired. After any major event in the body, you will get weakness after that. So it's a normal phenomenon. So nothing to worry about it first of all. And I will tell you, it may take some time to recover fully, around 4 to 6 weeks maybe. So it will gradually you will cover it, and after that you just have to change some your lifestyle. Like I will guide you for your lifestyle modifications according for your diet or your exercises. And one more thing, I would like to ask you about your lifestyle. Like, are you doing any exercises?
No, doctor, I'm very much scared to do any physical exercises. I want to ask you how much physical activity is advisable?
Okay. Have you ever heard of any cardiac rehabilitation program?
Actually, I'm worried about these exercises because I'm afraid that any physical activity may provoke a relapse.
Okay. See, you have just been discharged from the hospital. So, in that hospitalization period, they must have done all the investigations for your body. So, nothing to worry about it. But yes, you have to uh, prevent further attack. For that, you have to do some exercises. So, I will explain you today about your cardiac rehabilitation program. It is one of the program we are running in our hospital for the recovery of the patient, mostly for the post discharge patient. Here the people are trained people in this faculty, so they will tell you what to do and for how much duration you can do the exercises. and they are with you for the whole time. So they can guide you, and if you feel any symptoms in between, you are definitely, the help is there, and the medical help you'll get immediately. So you don't have to worry about it. And in that, it everything this all the exercises and everything, you will do it under supervision. Okay, so I will suggest you that you should join this program, and that will definitely help you.
Okay. In what ways does this program help me, doctor? And how much exercise I have to do? And what, okay, how long will it take me for to recovering completely?
After any major event, it may take 1 or 2 months to fully recover. And then after that, you can definitely go to your job and you can return to your routine activities. See, but in this program, they will definitely guide you day by day for your exercises and even your diet modification. And definitely, they will help you in increasing your exercise tolerance. Okay. So if any time during the exercises, if you feel tired or any chest tightness, you will get a medical help immediately.
Okay,
Secured place in that way.
okay, okay.
And would you like to ask anything else?
No, nurse, I don't have anything else, but I want to ask you, what are the other things that I have to bother?
First of all, I already told you about the lifestyle modifications like exercises and the diet. You need to change your diet a little bit more, because some risk factors for the cardiac event, like increased cholesterol or hypertension, diabetes. All these you have to take care of, all the risk factors, and you just avoid it. And one more thing, I will tell you about. You have to be very calm in your even in your emotional state. And any concern about it?
Yeah, uh, fine, doctor. I'm ready to listen to your suggestions and recommendations. I'll implement whatever you say. Of course, it will be a little tough. It's a Herculean task. But definitely, I will follow those things. Yeah,
It's all about the recovery process now. First of all, you forget about that. Nothing. You don't worry about the second heart attack. Like if you follow the instructions, and if you go through all the preventive measures, then definitely there is a very reduced risk of getting the another heart attack. So you just follow my advice, and it will be better if you take care it early. And tired, and the about your weakness, it will gradually wean off, and you'll feel definitely better after this.
okay.
And
I'll
medications
definitely.
are there also, that will help you definitely, that doctor has already given you at the time of discharge. So you continue with those medications, and few changes in your lifestyle, that's it.
Okay, doctor. Thank you very much for your valuable suggestions. I really appreciate your concern.
Okay.
Yeah.
Are you
So
are
now,
you satisfied with this, or do you have any more queries?
no, doctor, I'm very clear with you now. I got everything cleared. Thank you very much, doctor.
Okay.
Yeah. Now I'll give you the feedback.
Okay, sir.
Yes. Yeah. So, Swati, you are doing very well, no doubt regarding that one. Of course, you have some difficulty because the child is there, so you have to be distracted. Okay, that's no doubt, that is 100% sure. But okay, that is fine, no worry at all. So we can improve on a gradual basis, and definitely you will come out successfully. The next one is, what you have to do is you have to write down some points. Afterwards, not now. I'm teaching, I'm explaining in the video here. Afterwards, you can use them. The first thing is you are saying uh, this one. It is not fine. Those unnecessary sounds should be avoided in the first place.
Okay.
You should not say so many times. Now, don't say anything for some time until I ask you. Sir, you can even mute. You can mute. You can mute your audio. Yeah, these unnecessary sounds, unwanted, you have to avoid. That is very, very important. There's number of, you don't have control over that sound. That is the problem. So try to control in that area. The next one, whenever you are making these sounds, you have another problem. That is, you are giving some pauses and breaks. Giving some pauses and breaks. So avoid these pauses and breaks in the first place. Okay. If you don't have anything to speak, just close your mouth. Just close your mouth and bring it back to the pavilion. So lips, tighten your lips. When you speak something, afterwards, so your lips should be closed. Whatever you speak, final position is closed lips, mouth. Right. That's very, very important. Next, regarding the vocabulary. Oh, sorry, more than the vocabulary I have written here. Yeah. It. So many times you are saying it. After 3-4 times, then you are telling something. Then you, 2-3 times. It's okay. One time you is enough. One time it is enough. Why are you telling 3-4 times? So that otherwise what you do is thinking about the sentence, then start speaking. Just started speaking and afterwards you are thinking. That's not fine. Next one. Next one is vocabulary. The words which you are speaking, are not very extraordinary words. You can use excellent words. Compliance with the medication is extremely important. You could have said that, but you did not say. Medication compliance is extremely important. There is nothing to worry. Whoever faces or whoever has an infarction, okay, myocardial infarction, whoever has a stroke, okay, they will react in the same way. They will face the same problems. So, what you are supposed to do is first relax, accept the fact. You should not overwork. You should not strain yourself too much. At the same time, you should not even silently stay in one particular place. You should participate in some physical activities. You should participate in some physical activities. That is very, very important. Okay, regular physical exercises are needed. Regular physical exercises are very, very necessary. Right. Then, so what are you supposed to do again here is analyze the words. What is the quality of the sentence? What is the quality of the sentence? Is it good vocabulary or not? Are the words which I am using, are they excellent or not? If they're excellent, use them. Otherwise, change them. Nah? Take something else. Right? Okay. The next. What type of vocabulary we have to use? You use the C1 and C2 vocabulary. Don't use ordinary vocabulary, because if you use C2 vocabulary, you'll get A grade. If you use C1 vocabulary, you'll get B grade. So what word you're using is important. Next. Then grammar. When you're writing sentences or when you're speaking sentences, take one or two sentences, understand the relationship, and then join those two sentences with a connector. Okay. For example, if you are compliant with medication, the recovery will be faster than expected. Okay. If you are compliant with medication, the recovery will be faster than expected. Next. There is no meaning in being afraid of exercises, expecting that you will get another stroke. Alternatively, you should judge how much exercise is okay for you and limit it to that level. Don't stress or strain yourself with too much of exercises. In this condition of yours, you should neither be idle nor strain too much. Moderate level of exercises is necessary. Moderate level of exercise is necessary. So, neither work too much nor not work at all. Both are harmful. Better take a balanced opinion, balanced approach. Instead of working more or not at all, take some moderate level of exercises which you can bear, which your body can bear. Because if anything goes wrong, then the condition will deteriorate. There may be stages of no return also. Now the problem is managed. There may be chances of getting another stroke or not. That is totally different. So this is the way how you can talk different things. Yeah. Now tell me, you are saying something?
So should we tell the patient about the risk of another heart attack, because patient is already afraid and he came to visit us for the reassurance? Or
okay, now do you know that there are chances of another heart attack? Yes. You accept or no?
Yes, sir.
Then why you want to hide the information from the patient? Okay. I am your patient. I trust you. And I am coming to you asking for information. How can you hide the information from me? If the patient is not ready to listen, if you feel that something problem, then you can call their children or somebody else and talk to them. Unless and until you follow everything, you will not face any problem. Like that you get. Is that clear? Right. So that is all for the speaking. Now we'll